when we have these changes in belief and we start acting differently because now we don't trust anybody, we feel powerless, or we feel like things aren't getting any better, it's possible to do actions that are going to help fix the problem. It's not just thinking differently. Fundamentally, it's actions. Because I always like to tell people, it's kind of a little confusing, if you take your head and split it open that way, that's more or less the way your brain looks. You have the top part of your brain, which is the human brain, and then you have the middle part of your brain, which is a limbic brain. And what happens is that trauma affects the middle limbic brain. It doesn't primarily affect the human brain. And so probably one of the most common problems that people have when they're traumatized is they try to logically fix it. Say, I'm smart, I can fix this. And they try and fix it. But fundamentally, it's not a logical problem. And people don't know that. So they become so frustrated and depressed because they're trying to fix something that isn't logical. I try to let them know the proof that it's not a logical problem is that if you took 1,000 people and they all were traumatized by the same event, and they all got PTSD, and you lined them up, you put the more intelligent people on one end, and you put the less intelligent people on the other end. And then you said, okay, let's wait 6 months, and let's see who gets better, right? Well, what you would find is that there was no correlation or an inverse correlation between intelligence and getting better. What that means in essence is that people that are less intelligent are more likely to recover than people that are intelligent. So it's not a logical problem. It's actually an emotional middle brain problem. And that's the first thing to realize, probably one of the most important things to realize.